College, and I want to welcome you today. Want a big welcome to Dr. Shakoor for coming out to talk to us about preventing and treating cardiovascular disease. February is Cardiovascular Disease Awareness Month, and so at Chandler-Gilbert and Maricopa Community Colleges as a district, we're trying to do as much education for our employees as well as for our students about cardiovascular disease. So we're very delighted to have Dr. Shakoor here today to speak with us about prevention and treatment of cardiovascular disease. So thank you.
Thank you. Thank you. What a great crowd. I'm not used to talking to a group of such healthy young people. As you all know that we're here to spend this hour for know more about heart disease. Not only heart disease about your own health, but also of your loved ones, your mother, your father, your uncles, and things like that. And as you know that we have, those things do matter. Like the campaign for smoking, for example. The real advantage or the real difference which was made in smoking cessation was starting from the classroom. And the children, they go and talk to their dads and their mothers, the smoking is not right. That has the biggest impact. In the same way, if you know and are equipped with more information about heart disease, you are young today, but very soon you'll be losing your hair like me. And so, not all of you guys, I hope. So as we all grow and we all kind of handle things, things will happen to us and so on. So if you are at a better position, more educated about heart disease and about health in general, but particularly about heart disease, why your professor decided to talk about heart disease. One is there is a heart disease month. February is heart disease month. The other thing is that this is the most common cause of death. Is it in males or females?
Males.
Yes?
Males.
Actually, in both, actually. This is the number one cause of death in the United States, both in males and in females. And I can, there is a slide which this is a little very nice slide which I got from a newspaper. It's not the best. You can turn off the light a little bit. So basically, on the left side, these are all the accidental deaths. If you can look over here, is about 100,000 deaths. Starting from marine animal attack, snake bite, playground equipment accident, crushing by human stampede, and so on and so forth. And motor vehicle accidents, and they still are about 1/6 of the number of people who are dying with heart disease. If you look over here, 685. And there are other diseases you can see. There are HIV, alcoholic liver disease, viral hepatitis, and all those things are still a big impact, but not as close to what heart disease can do. So that was my point of asking that question. It is still the number one cause of death in both males and females. All right. Pretty much the same thing, and these are some of the major causes of death. You can see this slide here. But if you look over in male, this is the heart disease, graph for heart disease. This is for cancer. And same story goes for the females. Females is about 500,000 deaths attributed to heart disease, and this is the death due to cancer, and that also includes breast cancer. Most people or most females, they think that the most common cause of death in females is cancer, breast cancer, but that's not the case. Actually, it's still heart disease. And so that is the whole idea of naming these months to heart disease and diabetes, and you have heard about PAD, peripheral arterial disease. So those are to bring awareness, and especially in youth like you, this is the best time to kind of know what is good for me and what is bad for me. And if you had looked at the slide before that, alcohol disease was the third actually cause of alcoholic hepatitis and alcoholic liver disease. That's again a very preventable cause of death. So being young and having good time, that is something you have to pay attention to. Same thing, same theme. Now, if you look at this graph represents from about 36 years, 79 to 2006. If you look over here, the death rate from cardiovascular disease, if you look at the blue line is consistently dipping down, and up to at 1990, it has dropped considerably down, and this is when we started learning about cholesterol and smoking and things like that. The same impact was in females, but still the death rate from cardiovascular disease in female is still high. Although it is in the trend down, but if you look at it, they're still high. Part of the reason is that females live longer than men, and so they die of heart disease at a later age. But men die earlier. They just kill them. They kill the men. So that's what happens because they have longevity. So they die later during the time, their lifespan. So just very simple. Anybody who has taken physiology or anatomy? All right. Okay. Would you like to name these? I'll go. I'll help you out. So basically, I always tell my patient the heart has got 4 chambers. And you correct me if I'm wrong. So basically, it has 4 chambers, 2 on the top and 2 on the bottom. It is very much like 4 rooms together, really. So 2 rooms on the top, 2 rooms on the bottom. The top chambers, their job is to collect blood. So they collect blood from the body and from the lungs. So basically there are 2 wheels they're running like this. On one hand, it is the blood which is used up, which goes to the heart, and from there, so the blood from the legs and from the head, this blue line, blue color, this will collect here, and then this will go through that door. Remember I told you the 2 rooms upstairs? On one room, so the blood will be collected, and this door will open, the roof will open, and this blood will be will go down, and from here it will be pushed to the lungs, and then it will get cleaned, and then it will come back on this side to be delivered to the rest of the body. So the top chambers are collectors, the bottom chambers they are pushers. They just push the blood outside the heart. So their fancy name: right ventricle, left ventricle, and this is the right atrium and the left atrium. So the Valentine's Day is coming, so the real heart is this. So I don't know where your hearts are. This is the real heart. So the diseases of the heart basically are divided into 3 things. You have heard some of your cousins or brothers, or they talk about congenital heart disease. So what do you mean by congenital heart disease? Congenital heart disease is people who are born with you heard about so and so had a hole in their heart. So that hole, if you can go back please. So that hole could be right here. So there's a communication between these 2 chambers here, or this hole could be in between the top chambers. So those, if they're small, those holes are generally benign. That means nothing needs to be done. If they're big in size, something needs to be done. And usually that is done early in age. And most of the small holes, you can live with them and no big deal. And so this is the fat part. This is all the Burger King stuff here. This is all it's there with every normal heart. And it is sort of a protection for injury and trauma, and it gives little stability to these arteries. Okay, so congenital heart disease, like I mentioned, there could be holes in the heart, or very complex one. The blood actually, which is supposed to come on the right side, it is actually going to the left side, and so on and so forth. There's a lot of different combination but as science has progressed, and especially living in America, I am from Pakistan, and in third world countries, things are still really very, very dismal. And so you guys should be really proud of living here, and plus look after yourself. And there are so many advantages living here that you can get immediate help, and you get diagnosed and get treated, which is not the case unless you are exposed to other parts of the world and you realize what a great country we have here, and what a great health care. You heard a lot about Obamacare and all, but still, this is the best healthcare system we have. This is according to me. Right. So then the second thing is the valve. So, like I said, congenital defects, and these are the valve. So valve, especially in elderly population, like in 70s and 60s and 70s and so on, the valve can get narrower, just like the door. If it is used too much, like the hinges will get a little corroded, or they won't move as well. So the valve gets a little narrow. So that is the valve disease. This is by far, coronary artery disease is by far the most prominent disease in Western countries. If you go to India, third world, Pakistan, and places like such, valvular heart disease is still important. The rheumatic fever, you may have heard about the rheumatic fever. That is still, it's like a sore throat. Children have it, and there's a streptococcus, that's a germ which causes effects to the heart, and the valve get narrowed and so on. So coronary arteries disease is the most important group amongst these. So every one person out of 4 will get heart disease, especially in females. So think about it. But 1 in 7 will get breast cancer, but 1 in 4 will get heart disease. So you really have to pay attention and really have to look after yourself, and I'll tell you how. And so coronary artery disease, what does that mean? Coronary means the artery of a heart. Artery is self-explanatory, and disease. So coronary means the artery of heart. Next one, please. So the presentation of coronary artery disease. So I want you guys, like I said to you, that you are not in that bracket, but you can help somebody who is in your house, or you live with, or your uncle, or aunts, and so on. So most common presentation of heart disease is they usually have no symptoms. So they'll be just fine, and then you hear about one day, oh, you just was sleeping and never woke up, and you heard these stories, or somebody had a really crushing chest pain. That is angina. If somebody has a really crushing chest pain, like in Hollywood movies, his wife gets angry at him and he gets all excited, and he clutches his chest, and that is really one of the cardinal symptoms of heart blockages. Heart attack is, that the pain of heart attack is so severe that, like, really an elephant sitting on the chest. Really an elephant sitting on the chest. And so it is quite a bit. And so the associated symptoms which can be seen or noticed are patients are really sweaty and diaphoretic, and they throw up, and they're just pale. You can look at them and you can tell this person is not well. At least that much you can diagnose just by looking at him. And somebody clutching his chest, can't breathe, is pale, you call 911. That's the most important thing. As young folks, you have to do that, pick up the phone and call 911 and make him comfortable. Sudden cardiac death is a situation in which, like I said to you, that people who sometimes, young kids were in a swimming pool and they know swimming pretty good, but they die in the sudden cardiac death. That is called sudden cardiac death. Or somebody, like I said, who goes to sleep and then he never wakes up. That is called sudden cardiac death. So that is partly because of coronary disease in a little older population, but it can happen to young individuals as well. So that is something you guys need to pay attention to. So what should you do if you are around somebody who is going through this? Mostly somebody will be just sitting there and he just starts gazing in the air and not responding. I'm sure, how many of you have BCLS, or anybody has done
like American Heart Association, BLS, yeah, CPR first aid.
Yeah.
Oh, okay, all right. Okay, very good. I would encourage you to participate in that. Do you have a program?
We are actually thinking about developing one, Dr. Trum and I, Dr. Trum's daughter.
And safety does presentations for faculty, I know that at different times, but we can request it. I don't know for students, but we surely can request it through
Dr. Trum and I are
safety.
working on developing that because we do recognize there's such a wide need for it. And a lot of our students who are going to health professions definitely need them, especially to continue your education, get those on-field experiences.
Yeah, and especially they are very good if there's already a push. Everybody must learn this. It's a very simple technique, and it's really a lifesaver. Yesterday we were seeing a patient, so the person who was letting us know that her boyfriend, he just kind of passed out, and so she was able to thump on his chest, and he made it to the hospital, and he's alive. So really, you can make a big difference by knowing that simple technique. So, like I said to you, what is coronary artery disease? Coronary artery disease is basically, this is your normal artery, just like a normal pipe, and slowly there's a little plaque built up. How does this come here? I think I have another slide. But anyway, this is, so suppose you're sitting in a vessel, in the artery of a heart. So basically, like you have seen in those Batman movies, those things are kind of hanging in there, those then this hero is just running through those pipes. So just like that, there is a plaque which kind of starts slipping into the walls of the artery, and it makes its home inside this wall, and it starts growing just like a pimple, if I may say so. So this is just a pimple which is growing inside. Right? So this is the plaque will continue. You keep on eating Burger King more and more, and this is here Dairy Queen, and this is the real stuff. This is blood clot. So what happens is one of these days, this margin is like a very tiny thin film, which is holding this LPU, like a crazy glue here. And so the moment there's a little hole, this will automatically just pour in, and this will form a clot, and here is your heart attack. Like you have one accident in I-10, the whole thing kind of piles back, just exactly like that.
Can you tell me, doctor, we
Yes.
have so many students in the room, and I happen to be the director of student support. I'm seeing a lot of students that go on the weekend for a party and take ADD meds along with alcohol, or take narcotics along with alcohol, and are having heart pains and panic attacks and things at parties, and then come. I mean, what is the mixture of that kind of, and what can happen?
I can assure you, nobody from this room does it.
Of course not.
Well, if let's say, like I mentioned, like alcohol, that was so medication or the drugs and stuff like that. That can create a big problem. Like I have seen young children who come to the emergency room 20 years of age. They have done cocaine. In those days when I was in that part of the country, a lot of cocaine was just new, and people would do cocaine and they would come in, sometimes with cardiac arrest, full cardiac arrest, because they had a little more or whatever was going on, and so really bad news. So you have to, like I said to you, the body is such a big gift, to humans, and a perfect body. There's nothing more beautiful in this world than the human body. If you look at it, there's nothing. You can tell your girlfriend as well. Say, and it is so perfect. It is so perfect that it is. So you have to. It's a duty as a human to look after that. And these are all poisons. And yeah, they are great. They have a lot of fun with them. But you guys have to balance it. All right. So again, we'll continue with the theme of coronary artery disease. So these are the coronary arteries. Coronary artery. So there are basically three arteries. So on the right side is like letter C. It goes like this. And on the front, this artery comes like this, and then it gives a branch. So, but it comes as one artery here. This is very important. This is the most important real estate in the heart. This is the most important real estate in the heart. Why? Because if this thing gets shut off, both branches won't get any supply. This person will die right away. And Emily and myself, we have seen a lot of patients, and Marie does the stress test, and we sometimes are always worried about those patients who have left main blockage when you put them on a treadmill. And the second place you see in healthy people who are just keeling over on the treadmill is when they have this blockage right here. That's the left main disease. So that just for your information, nothing. And this artery is called widow-making artery. This is the LAD. We respect a lot. We're very scared when this thing happens. So why is it called widow-making? Because it supplies a lot of heart. Any blockage to this artery will kill the person.
I do know some of the students actually have class coming up.
Okay.
So the students who have class coming up and that need to leave here, thank you so much for coming.
Yeah, if you have any teen, when they will be brought back, they will undergo an autopsy. And they found that about 7 to 8% of those young kids of age 19 and younger had very high degree of stenosis, a high degree of blockage. But remember, those were the days when smoking was very common, and when they are in the war zone, it's totally different. But yes, and actually the heart disease starts when you're young. Maybe news to you guys. But because the way we eat and the way we look after yourself, heart disease actually is not a disease of elderly, but it is a disease of younger folks. It starts from the young age, and it's slowly, like the pimple, like I showed you, it takes time for it to grow. It doesn't happen in one day. It slowly keeps on getting bigger and bigger. So these are some of the myths about heart disease. Heart disease is caused by stress, worry, or overwork. Actually, there is you have heard about on the TV, the broken heart syndrome. So there's especially in females, and especially if they have lost a spouse, or there's an earthquake, or some big loss, or they failed driving test, or something like that. So something big, really big of that intensity, if that happens, they really can have a heart attack, have chest pain and all that. We didn't know that for a very long time. We have just learned about it about 10 years ago or so. So it's relatively new. So extreme stress can cause heart attack, and perpetual stress can lead to heart disease. So there is some relationship. So you have heart attack and you are bound to die of heart disease. That's not true. What has happened is that in 1960s, when somebody had heart attack, you just put them in a bed and give them morphine, oxygen, and just pray for them. And we didn't have much to do. Then there was a very smart, very bright cardiologist in Kansas, Dr. Hartzler. He was the one who actually started the treatment for the blocked arteries. And before that, there was a young man from Germany. He was 40 years old. He used to do experiments on his cats. So what it is I'll show you if I can get hold of that video. So you can. So he will, if there will be a blockage in one of the arteries, he will go there and put a balloon there to try to open it up. And there were no balloons, and he will take condoms and he'll make balloons out of that, and he will put it in his cat, and that's how this thing all started. So after that, after 70s, this thing whole galvanized, and just kind of everything started rolling, and we learned a new treatment of heart disease, that putting in stents. You've heard about balloon angioplasty and stents. So we have come that far. So the people, there was mortality means that 3 people out of 10 will die of heart disease if they will not make it, if they had a heart attack. So they're done. It's a pretty large number, 30%. So after that, now the mortality or the death rate has gone down to a single digit. So less than 7-8% people die. Still people die of heart attacks but the number has gone to very small. The number has gone smaller because of because of cath labs and so many advances which we have. And rest restores the heart. Not true. Even after 5 days of heart attack, we have patients kind of go out and start exercising at a low intensity or start walking. Excitement or shock could cause another heart attack. That is true actually, again with the same token, if there's too much going on or people are the excitement will be the same things with the cocaine, for example. There's the excitement, there's the vasospasm, people will have heart attack. So, okay, I will spend some time just to tell you what you should watch out for. So, diabetes, you've heard about, and high blood pressure, abnormal cholesterol, family history, smoking, and stress. But if somebody has that, suppose you have in your family. So let's start with diabetes. Diabetes is something which if somebody, your loved one, your mom or dad or somebody has, make sure they exercise. And if one of you have it, there are good treatments out there, and there is a good, as long as you stick with the plan, I think you can have a very normal life. But with the virtue of having diabetes, you are more prone to having heart attack. Half of the patients with diabetes die of heart attacks. Half. Pretty big number. So that is that's where the heart doctors come in action, and they work with that. High blood pressure, if somebody has high blood pressure, there are really good medications out there, but that increases the risk about three times. Abnormal cholesterol, we have studies to show the higher the cholesterol is, the more risk to heart attack. Family history is a little tricky. In males, if somebody has their loved one 55, if somebody like brother or sister, actually brother or father is more indicative. If they have heart disease, then there's a good chance that you are at least 2 to 3% more prone to having heart attack, or heart disease than heart attack. And then if your mother has heart disease, then it is 65 or older. So it is the older. Why is that? Because the ladies, they develop heart disease a little later in life. So the heart age of a person, suppose who is 40 years of age, as opposed to a female who is 50 years of age, they are the same. So there is because they have hormones, because of the ovaries and things like that, they develop menopause a little later. So they are a little protective. But that protection is gone after 55. Smoking is one factor that, if anybody in your family or your friend or loved one, please talk to them. You don't know how much power youth has. You guys, even you're talking to your dad or your mom or to somebody, if you just tell them, please stop smoking, and of course you're provided that you're not a smoker yourself, right? It is such a powerful thing coming from a young man that really matters a lot. You have heard about people who are 85, 90 years old. They just want to be around young people. Sometimes you say, well, why is he so happy to see me? My grandma, what's wrong with that? Oh, she just goes all over you. Because you guys have so much energy just by being there. I mean, you don't realize that you realize when you're 85 that what you had. So use that skill, use that. Just to give you some background on that. So there was a study which was done in which the doctor would only ask the patient, do you smoke? After that, he's not going to give them a big dose of lecture or anything like that. Nothing. He'll just ask, do you smoke? So what they learned was that all those patients who were asked this question, they stopped smoking about 7%. So it's a big number. Think about it, 3 to 7% of patients stop smoking just by asking this question. What a great intervention is that? Right? So there has been studies to support that. And actually, I misspoke, it's a 3 to 7%. So it's not that high. But even 3%, if you take out 3% of smoking reduction just by asking this question, that's great. So stress, again, as I said to you, stress has a role in And then minor factors are obesity, inactivity, diet, and gout, and hormonal disorders. So obesity is sort of a new kid in the block because we didn't have obesity about in 1980s. We are growing bigger and larger, and like our McDonald's is the best reflection. You know. They are supersizing it, and we are supersizing it. Inactivity, we have more computers, more gadgets. We don't go out, we don't walk, and so that's something. Our diet is really. I mean, in school, I think when you guys were in your high school, what kind of food were you given in the cafeteria? That was terrible. But things are getting better, and so that's where everything starts. Gout is the uric acid disorder and hormonal disorders. Basically, somebody has growth growth hormone problems like acromegaly, things like that, and those type of things. Next one, please. So these are the changeable factors: hypertension, cholesterol, obesity, physical inactivity. The next one, please. Non-modifiable risk factors are age, family history, and gender. So now you may be thinking that suppose my dad has diabetes, or my dad has heart disease. How will I fare out? What will happen to me? Will I get heart disease? No, not necessarily. If you are able to change, if you are able to make a change, if you are able to control all the risk factors, all the possible risk factors, like you start walking, stop smoking, these are simple things. Start just walking. We have learned that walking just 150 minutes a week, so that comes out to be 30 minutes a day in 5 days a week. If you do that, you drop considerably the number of the risk of heart disease, both heart disease as well as diabetes. And you drop some blood pressure as well. So everything revolves around activity. Number two is your diet. If you are careful with diet and try to stay away from these fatty foods, there's no need to go like too much into label. Just look at, there shouldn't be much bread in whatever you eat. There should be more proteins, and there should be less sweets. And soda, you should try to get rid of the soda. Just, you don't have to read labels, just these simple 3 things. I know it's hard for you guys, but if you just pay attention, you can really make such a huge impact on your life today. I'm not telling you to put bandanas and run like crazy. I'm just asking you to just make these some small changes.
Yeah, that's your job.
Yeah, I've never seen anybody smiling when they're running. They're all in pain. So that's good. So gender has males are more prone to have heart disease, and that's okay.
I have a question about that with gender. I went through my undergraduate degree about 20 years ago, and the list was very similar. But also that's at a period of time when most research was focused on males. And within that last 20 years, kind of the curve, as you were showing, females have kind of more emergent. Do you feel like that's still really a risk factor more for males than females?
Yes, I see the reason gender is there is because of the hormonal background.
Is it age, gender type, or more just until 55 or until postmenopausal?
Gender, males have a little high risk profile, so to speak. They are more, with testosterone and smoking, and they are generally not as careful as females are. And so that plays a role. Plus, in females, it is mainly the protection of the ovaries, the estrogen and progesterone, which helps them. And as you can, there are some slides that have that. After age 55, that advantage is gone.
Okay.
And so they are pretty much even.
After one
Yes, and actually, so what happens is the males start dying early. They're dying, and so by age 70, the rate for heart attacks and deaths from heart disease is more in females. not because
There's more around.
they're more around. That's absolutely. So that's how the gender plays in.
Yeah.
And so, and the smoking was a big deal. If you, I don't know if there was a dip there in that graph. That was, we think that was related to liberation of females. Supposedly we liberated them and they started smoking. And that's a big deal. Smoking made such a big impact on their lives. Bodies of male can handle smoke slightly differently than the female, and that really have made a big increase in their heart disease. So again, like I said to you, this is a normal artery, and that's we call it fatty streak. This is the very initial stages, and most of us will have fatty streak in this room, although I have pumped you up that you guys are so young and so beautiful, but you will probably have little bit of fatty streak still. So how could it be? Well, even when they have learned that even in the womb, when the baby is in the mother womb, they see this fatty streak in those. Why do we see that? Because of the estrogen and progesterone. When they grow up, it disappears, by the way. So this fatty streak actually eventually becomes this yellow grummus, and that, like I said, it is separated by the very thin layer, and that's what ruptured. And that's, so this is again the blockage. Slowly, actually the artery, God has made such a smart body that the body tries to maintain its opening. It maintains its opening as much as possible. So when there is a plaque, like I said, that jelly starts developing outside, if you look at the size of the artery, the inside of the artery stays the same. And it starts growing on the outside. And until a point comes that it cannot grow any further, then it starts encroaching to the. So there's a lot of lag period before, so there's a lot of time when we can react. So anytime really you get active, you will get the benefit. Yes. So what is an EKG or ECG? ECG is the real name, electrocardiography. We call it EKG just to separate from EEG. When you write that, EEG, so some people can mistake for that. But really, EKG is just like a picture, so it does not give you, like some people say, well, I had a normal EKG 3 months ago, how can I have a heart attack? But people can have very normal EKGs and still can have heart attacks. Or people, a normal EKG is a good thing, but if you have a normal EKG, that does not protect you from a heart attack. You can still have a heart attack. So, but if a bad EKG is really bad, but a normal EKG is not protected. That's what it means. Next one, please. So this is the treadmill. You may have seen people. Marie does that every day. She's this person here. And so basically, you put a lot of leads. What happens is that when the heart is under stress, there's a thing called ST-sec. There's some EKG changes, which we can very readily see. And like buying an old car, if you buy an old car, you take them to I-10 and put as much gas as you want. That's what we're buying the old car here. So basically, it tells you if there's a problem, that will show. If there's a problem, it will show, or somebody won't be able to do it. And so that is that. Next one, please. And these are the arteries, the real arteries. And I had, see if I can show you something. Yeah. So this is the more prettier picture of the heart. So these are so the testing, suppose somebody tells you that, your dad tells you that, I went for a doctor visit and he did an EKG and did a treadmill and I was fine. Can you still have a heart attack? Yes, you can still have a heart attack. Why? Because these tests are not 100%. My job is to look in the crystal ball and see, if this guy is going to have a heart attack or not. That's what I do every day. And I have certain tools which I use. EKG is one of them. Treadmill is one of them. Then CTA, this thing is one of them. Then there are certain calculators which you can use on the iPhone. I just downloaded it today. There's a new calculator. You can put your numbers in there. You can get, or see where you fall in that category. But I wanted to show you some really. Okay, so I've scared you enough. What can you do? So diet, like I said, the best diet is a balanced diet. So in general, more fruits and vegetables. You've heard a lot, so many times. I'll just tell you the same thing. And it is, if you start it from now, you will make the difference. Don't ever let your belly stick out. Very important. If you want to know what is the most important part which can actually forecast somebody's health, that is that. If somebody has developing belly or your pants start getting tight, you better shape up. Because like my friend says, a word which has been said from a mouth doesn't come back and the belly doesn't come back either. So they are very similar things. So you must try to do that. Forget about every other measurement. If you can do that, you are in good shape. So diet, stick with low cholesterol, less carbs, more proteins, more fresh fruits and vegetables. I think you can expand more on that. Doctors are the worst people to ask for diet because we don't know. The best person to ask about diet is dietitian. They are the experts, they know more, and you shouldn't talk to them but you guys don't need to see a dietitian. You just need to run and eat balanced diet. That's all you need to do. Cholesterol, people are, there's a thing called FH, familial hypercholesterolemia. After age 20, you must get cholesterol check. After age 20, but in fact sooner, get your cholesterol check. So what will it tell you? It will tell you there's a thing called FH. FH is called familial hypercholesterolemia. And that is not as uncommon, but it's quite common. So it's 1 in 500. So if those people have very high cholesterol, so at least screen that. If you have very high cholesterol, you won't know it until you end up at age 40 and you go to a doctor's office for a life insurance and so your cholesterol is very high. You have missed that 20 years. Get yourself checked out. Number 3 is exercise. Exercise, 30 minutes walking is great, but that is for people who don't have time. You have to make time for exercise every single day. Should be no question. Like you eat food, you have to get out and exercise, no question. Smoking, we are not smoking at all, right?
Not never.
All right, good. Alcohol, again, I don't know what to say about it, but just the guidelines for alcohol are that if somebody, and it has some protection as well. Alcohol, you heard about protection. So what is the protection? The protection is that all the studies which have been done for that alcohol is healthy, they use a very small amount of alcohol. Not like the bottles of alcohol, and so that is not protective. So that is helpful. But the guidelines are that if you don't drink alcohol as a habit, don't start alcohol to protect your heart. So you can get the message of it. So, but the good part of alcohol is in the grapes, the skin of the grapes. So you can have grapes if you want. And it's really want to have fun. So stress is not good. And so what is the real data about? There is a good data about stress. People who have heart attacks and they go into depression, and because they don't feel as strong and so on and so forth. But stress is known. Like we have heard about type A personality. I'm a type A guy. The people are those guys. Stay away from them. So you have to kind of learn. There's a lot of stresses. Nobody has a life which is stress-free, right? So you have to learn how to get out of that firing range. You have to fight at a high altitude, cruise at a high altitude, because there will be problem in your job, right? There's a problem with the teachers, problem with the doctors. So there's a problem all the time. So you have to be smart about it. Don't go head on with problem. Try to be smart. Try to stay away from, and try to have a little thicker skin. All right. So, I just mentioned that to you guys. I'll tell you that these are the two things I would like you to know about from this slide. So there, when you go to doctor's office, what should you ask? Basically, they always talk about good cholesterol and bad cholesterol, right? You heard about that. So Emily will tell you what is, how do you remember HDL?
H is for happy.
Happy, oh good, very good. So high density cholesterol means that is the happy cholesterol. So you want to have more happiness, right? So when the doctor gives you a number, it should be higher number. L?
Lousy.
Yes, L for lousy. So you should have low LDL, right? L is for lousy, so you want to have a less lousy cholesterol, right? LDL. So those are the two things I want you to know. And so HDL is genetically determined, so you are born with that. So, but you can exercise, and that will increase your HDL. And LDL is 80% of LDL is based on genetics. Only 20% you can control with diet. So if I zip my mouth completely, I will have 80% of whatever cholesterol I have. So diet is important, but it is your genes. You cannot dodge your genes. So these are just, forget it. So, okay, the next one, please. So this is just a little roadmap for you guys to remember. Again, all high numbers are bad except HDL, right? You want HDL, like I said, happy cholesterol. You want to have more of happy cholesterol. So all other numbers, if they are high, they are not good. HDL should be higher. Yes.
Oh, I was going high.
Yeah. But triglycerides are the fat particles which you like. If you go to Burger King, I know I like Burger King a lot. So, but when you eat that Big Mac, and I check your blood will be actually white for 15, 20 minutes. We never, let's hope nobody gets to see the blood after 15 minutes. But that is what it is, because there's so much of triglyceride floating around in your body. Next one, please. And so, good cholesterol, basically good cholesterol is like a Pac-Man. You used to play Pac-Man, right? Mm-hmm. So HDL is like Pac-Man. When the cholesterol it goes and that pimple I showed you that's sticking to the wall. So Pac-Man goes and eats it up and takes it to the liver to get it clean. So that's why we want more HDL. That's why we want more HDL to be in your body. So it cleans up, scrubs it, and takes it back to the body. So there's less plaque in there. All right, thank you. Okay, next one. All right, this is our problem. Pay attention to this guy. He's having a great time, having a soda, watching a TV. I think his wife is not home. I can bet. His dog, poor dog, punishing his dog. I think he's trying to
Taking his dog for a walk.
And this is another very interesting slide. So they're 24-hour fitness, but they're all using the escalator. So there's nobody, they're too tired to go there. So any question you have, let me know, please. Yes, please.
I do have a question. For the last 7 years, I've been working on my body.
Right.
But I feel like more I work, more I get bigger and bigger. But I know what it is. But I didn't change my.
Yeah.
I didn't change. Either I'm working on my food, working on what I should take. What I should eat, like coconut oil, and my cholesterol is high.
Right.
My happy
Yes.
cholesterol is good.
Okay.
But my lousy cholesterol is bad.
Right.
But I use olive oil. I've changed the way I eat for the past 7 years. It's
Right.
a process thing that's
Right.
been going on.
Right.
So now I'm on the exercising part. But I want to ask you a question.
Yes.
Do you think that, and how I know that I'm not healthy at all, because 2 years ago I was trying to open a business, and I got really stressed out, and
Right.
I went through emergency, and they were saying I was having heart complications.
Right.
Yeah. And then that's when I knew I had to get really down to business. I exercise more diligently, you know.
Right.
But my stomach is big.
That's okay.
And I wanted to get the tickle, the lipo, get fat off of it.
Uh-huh.
Yeah, do you think that because you said something about big belly, that's how you know you in?
No, well, see, I didn't mean that way. See, the thing is, and we see patients every day. So this is, see, there's no problem which cannot be fixed in this way. So, yeah, the purpose of this whole talk is to make people aware, not to make people depressed about it.
Oh, no.
So you are on a great track. You already understand that. See, the 50% of problem is when you realize there is a problem. Half of the problem is solved. If you realize that there is a problem, and so 50% is easy to fix it. I think your best suggestion I would have for you is that you see a registered dietitian. And you're not a diabetic.
No.
So I would still see a dietitian and sit with them and make an appointment with them and go over what you. Like I said, doctors are not the best people to ask for diet. They'll look at your caloric intake and all of that, and if you don't want to do that, I would get a very simple, these apps, there's an app called myfitnesspal.com, I think.
Oh, yeah.
So then use it, Just use one thing and just stick with it. What the story is that there was a study, so the patient, there was an actual program. So a lady came to the doctor that I cannot lose weight, and she had all the diary and everything, and all the numbers, calories, and all of those things. And she would swear that I eat 1,800 calories. That's what the doctor had told her. So what they did was they followed her with the camera, hidden camera, and they noted everything she ate. And actually, she was consuming 3,000 calories. So, but understand that it's not that she was she was trying to dodge him. It is how when she will count, it's probably 100 calorie apple, but actually that may have been a 150 calorie apple. So she thought this cookie is for whatever size. So it is just how the mind works. Like, you always want to be taller. When you are 5'11", you say, I'm 6 feet. So the same thing. So you always want to go on the other side. There's some psychology attached with that. So I would still, in simple, if you want 30 minutes of walk every day, and just get rid of carbs as much as possible. Have breakfast in the morning. Breakfast is very important. The most important meal of the day is breakfast. So and sleep, please, you're students, you dodge on your sleep a lot. So 7 hours is very important. You have to stay, actually, if I have a slide, so Americans were sleeping, in 1930s, they were sleeping like 8.5 hours. Of course, there was no HBO and all those things, granted, but still. So that trend has continued to go down. So right now, average American is sleeping like 6 hours and 20 minutes, which is not enough. And you at least should try to get 7 to 8 hours of sleep. And that's very important. So do that, sleep well, eat well, walk, and diet, like I said, my really suggestion is stick with fruits, colored fruits, and stick with the fruits and vegetables as much as possible, and you will see the difference. And these olive oil and this coconut oil and all these things, stick with olive oil and don't put too much in this. So whatever you can, it makes life complicated. You won't be able to do it for long.
I spend a lot of money at Whole Foods.
Yeah, Whole Foods is bad place. Go to Sprouts.
Oh my goodness. I go to Sprouts too.
Sprouts or Food Club.
Trader Joe's is great too, like Trader Joe's.
Sorry?
I like Trader Joe's.
Yeah, Trader Joe's. Yeah, Trader Joe's.
As far as like sometimes I only get like 3 hours of sleep because I have no schedule. Can I make that up on the weekend?
Right. You can.
Cool.
You can make money. Yes, that is true.
I try to keep my diet as clean as possible, but I can't survive without my caffeine. What's the like impact?
Very good.
Of impact?
Yeah, you see, they initially, when we were growing up as a cardiologist, we didn't know that caffeine has any big impact, but now we know caffeine can actually hurt too much of caffeine. And so what is too much? They say more than 2 cups. It can, no, not in that way. You can start seeing the effect. The lower it is, the better off. But 4 cups is acceptable. But more than that, it will be, depending on what type of shape you are. I mean, drinking 4 cups to a person who has heart disease is very different than a young person. I think you're okay with that. But generally, caffeine messes up your sleep big time. And so that may be reason you, probably your own work related, but try to stick with more sleep and less caffeine if possible.
Okay. Yeah.
Yes, ma'am.
And Diet Coke remains bad for you still?
Still today.
Hate that thought. But I have 2 kids that are coming to 20, and you said to take them in to get their cholesterol count.
Yes.
Okay, both levels of, they just do a whole
They
cholesterol
generally, when
level?
you go for, they call lipid profile.
Okay, and then after that, how often should you get it checked?
Well, after depending on the results, if the results are normal, then no need to worry.
Okay.
Basically, this first test will be to rule out if they have congenital problems, they're born with that. And you don't know it unless you get it checked. So that's the whole idea.
Okay, great. Thank you. How about, nobody else has a question. How about a little pacemaker here? What happened, what's the difference between, it isn't one of those valves and all that, but it's something else that goes wrong with your heart and you get a pacemaker.
So the question is what the pacemaker. Pacemaker is a external, like a little device which you put it underneath the skin. And so basically there are 2 types. One is called the AICD, the defibrillator type. There's a little bigger size. And that you will see those mostly in more sicker patients, more elderly. Pacemaker could be in a very young individual. So many times they're born with some electrical problem, and because heart has some conduction tissue, and that's how it beats. For that, they put a pacemaker and leads and things. So that's no big deal. AICD, if somebody has the AICD, that person probably has a sicker heart and is in more trouble than the other person.
And you can have a healthy heart with a pacemaker.
Of course.
Yeah.
Of course.
That's what I have.
Yeah, but of course you can have a healthy heart. See, I'm sorry if I scared anybody. It's just that you're a healthy people. Just stick with the plan. Breakfast, sleep 7 hours. Walk 30 minutes at least. I know you guys walk in the really long hallways, but that doesn't count. You have to sweat. You have to sweat.
Yeah.
And then eat more greens, and you're fine.
You say we need to get at least 7 hours of sleep, but as far as oversleeping goes?
Okay, all right. So there's a thing called oversleep. Oversleep means like you sleep 9 hours or so. What they've learned is that people who dodge or cut short on their sleep, suppose from 7 hours to like 5 hours, they die of heart disease. Patients who oversleep, they die of other reasons, other diseases. And you can imagine a person who is not getting out of his bed probably is really sick, 8, 9 hours. So that is a relationship. If you cheat on your sleep, then people will have, because your body didn't get your overhaul in 5 hours. You need 7 hours to get everything all neat and clean. See, we think that computers are very smart, but body is so smart. It knows exactly what is happening with you. At night, there's so many things which happen at night, and the melatonin and all those things you eat from Trader Joe. But those are basically, they were started from these frogs. It was because the frogs actually change colors because of the sunlight and things like that. So it is, melatonin is actually related. We secrete melatonin at night, and during the daytime it disappears because of the light puts it back in your brain. It's so it's very smart. You can't fool with your body too much. A little bit is okay.
Is it true, a lady, I think she was like 70 years old, she said the body heals itself, so at a certain time you have to be asleep, but at a certain time that's when it's healing.
Absolutely.
Yeah.
She's right.
But I want to thank you so much
Well,
for
thank you.
coming out.
I hope it helped you, but call me again.